Welcome to Chats with the Chief. I'm John Jensen, Chief of Staff at the Veterans Health Administration, and this is the podcast where we make small talk about the largest integrated healthcare system in the country. This week, I'm joined by Ms. Pamela Powers, Acting Deputy Secretary for the Department of Veteran Affairs. We talk about the new electronic health record Go Live in Spokane and our commitment to innovating the veteran care experience. Enjoy the show. So what is something that's maybe the most unique or that people should know about you that they wouldn't necessarily know?
Something different that not a lot of people know is I'm an All-American springboard diver.
I do know that, actually.
You did know that?
I did know
How
that.
did you? I think the boss told you that,
Yes,
right?
yes.
Yeah, no, that is, I probably would kill myself if I was on a diving board right now. But I have scars on my head and, bruised knuckles to show for it. But yeah, that was a long time ago.
That's fantastic. Well, we talked about actually coming down to Minnesota that you were.
Oh, that's right, yeah.
That swimming became a part of something.
Yeah, well, who would have thought?
Yeah,
In
exactly.
Minnesota, actually a lot of swimmers and divers come from Minnesota. Every high school has an indoor pool, so it's unique. But
Interesting. What lesson or piece of advice have you ever been given or heard that has stuck with you that you either share or think about sometimes?
Well, Sue, something my parents always taught me, and I've tried to instill in my children, and it's actually in a big poster. I found it online one time in my den at home, and it says in big letters, work hard and be nice to people. And that's really the bottom line, right?
That fits me to the T. That's what I try to do.
Yeah, you don't always have to be the smartest in the
That's
room.
right.
You just have to work your butt off and treat people with respect, and that's the key to success in my mind.
Wow, I love that. I'm gonna take that.
Yeah, well, you can find a poster online.
I'm gonna look for it. I'm gonna put it in my living room too.
There you go.
So I know you've been the acting deputy for what, 5-6 months
Since
now?
April.
Oh yeah, that's right, since April. So a while, and you just because of COVID, you haven't been able to really get out and visit folks, but you have lately, and you've been hitting
Actually,
it really
yeah,
hard.
I've been since April. Actually, I think I went somewhere in March too, up to New Hampshire
Oh, that's
to
right.
accept that PPE. I've been to, I think, 10 different states. So yeah, I've been trying to get out to thank all of our incredible staff who have really been on the front lines of this fight. And also to continue our modernization,
Yeah.
right? We could have easily said, okay, we're just going to halt all of our transformation until things are perfect and there is no COVID. But we know we owe it more to the veterans, right?
Right.
We know that we're undergoing the largest transformation and we have to continue those efforts. And which we have. I mean, as you've seen, this
I know.
week is a really
exciting.
big week.
Yep.
We just went live with our electronic health records modernization on Saturday, and it was a near flawless execution implementation. And it was probably one of the most complex, as you know,
Yep.
integration efforts out of any electronic health record implementation ever, even in the private sector.
Correct.
I mean, we had, 75 interfaces that
Yes.
we had to develop and integrate. Private sector only typically has a third of that, and DoD had half of that. So really, really proud of our VHA team, our electronic health records team, IT team,
Right.
OEI, everybody is really, it goes back to that emotional intelligence,
Exactly.
right?
Yep.
Because this team worked together to implement one of the largest, most complex transformation efforts in VA history. And I think if we weren't emotionally intelligent as an organization, we wouldn't have been able to do that.
I completely agree, and I think that leadership also is
Yeah.
how we got to this
Great
point. You know,
leaders.
great leaders up and down,
Most
from the
definitely.
medical center director there in Spokane
Yeah,
to
great
EHRM,
team.
secretary, and yourself. I mean, I think
Thank you.
leadership sets the tone for those things, as well as give the opportunity and the emotional intelligence to be able to get to those
Exactly.
things. That's how you get to it. And we were just out in Spokane together a couple of weeks
Most
ago.
definitely.
And to see what happened there on the ground and the employees that were so motivated and so excited for
Yeah,
the
they were
opportunity
ready.
to go. They were ready. They
Yeah.
were more than ready to do
Most
it.
definitely.
And so I was not surprised that Go Live went so well on Saturday. And here we are on Tuesday the following week, and it's moving along. And I think yesterday they even had a power outage in the city.
Oh, no, so get this. So Saturday, well, first of all, we had the pandemic, right?
Right.
And we could have easily said, no, we're not going to do this because of the pandemic, like I mentioned. But then they had wildfires during their mock Go Live,
Right.
which they had to move a bunch of people to a different location. They had to do some virtual training, and that almost stopped us. And then Saturday, we went live that morning. Friday night, they had a massive snowstorm, a couple feet of snow. The facility lost power. They had to go to generator power. They had to move the headquarters. So it really showed incredible agility and determination, and they made it happen.
Well, if nothing else, we've proven during our time with COVID. We have another hurricane coming up the Gulf Coast today,
Most definitely.
hitting by the end of this week.
Sure.
In the next couple of days. All the wildfires we had out west. We started the year off with earthquakes.
Yeah, what
and
else
a volcano
and fires.
in the Philippines.
And fires on the West Coast.
And now we have a major snowstorm taking off in New Mexico today.
2020,
so.
I can't wait for it to be over.
How's your 2020 been?
Actually, it's been pretty good. My son got married, so that's
good.
the one good thing of this year. But overall, it's been really challenging on this organization. And I am humbled by how incredible our team is across the board. VHA folks, everywhere I go, are just in it to win it, right?
Yep.
They're in it to serve veterans and in it to make a difference, and incredibly dedicated.
Well, I see that as well. I'm so proud of our employees, especially throughout all this and all the issues that we've had with, as I mentioned before, COVID and stuff. You mentioned that, you kind of lead into my question is, you've done some travel, you've been to 10 states, you've seen a lot of things that are happening. What's something that you learned? I mean, obviously you can see it in the employees, but something that you learned or didn't really realize until you started beginning to do a lot of this travel?
Well, Sue, I think every facility that I go to is a little bit different, a little bit unique, has a little bit different focus on innovation. And one of the things that excites me most is how innovative this organization is. And every facility has something they're really proud of. And I love seeing that. I love seeing their excitement. I was just out in Seattle and got to wear the goggles, the 3D goggles. And I saw this spinal cord patient on the video. And what they're doing, and I'm not a doctor, so I'm actually going to probably embarrass myself by even talking about this, but they've put a little chip in his brain that allows him to think and do, right? So he can think about what's going on the computer screen and move the mouse by just thinking about it. And so it's really the future.
Right.
And I see that every facility that I go in, there's something unique and special about that organization that makes them very excited to get up and go to work every day, not only because they get to serve veterans, but I love innovation. It's one of the things that I think this organization does really well, and it's in our genes. I don't think the nation knows about how innovative this organization is, so that's what I'm really trying to do, is I'm trying to get that message out. It's exciting, innovation for this organization.
It is, and again, if you think about it, you're doing all this in innovation and looking towards the future in the midst of a pandemic that we haven't seen in 100 years.
Yeah, most definitely.
And the employees are still showing up, still doing what needs to be done, and as well as we have employees on telework, we have virtual, we have employees that are going into our hospitals every single day, and they're still able to.
Well, so, and that brings up a good point, is that's another thing that I saw at all of the VHA facilities, is the innovation during COVID, right? Every single one of them had to stand up a COVID ward within a week. And most of them didn't have the expertise or the equipment to do that. They were also innovating on the PPE side, because for a while it was really scarce, and they all had to try and figure out, working with the team up here, on how we could get the needed supplies and equipment and shift resources. And you saw that, how we shifted across the nation and reached out to our partners in the communities to help where needed. How many people do we have now that have done that fourth mission is incredible, and worked in private hospitals that were overrun with COVID, or private nursing homes and state nursing homes. It was really incredible to watch. So that was one of the things that I was out there at all these facilities, was to thank them. But also it was neat to see all the innovation.
Yeah, and you mentioned an innovation in the midst of a pandemic, as well as the employees and their efforts that they put in, volunteering for DEMS missions. And we're not out of the woods yet on COVID. We're spiking back up again, and we're looking for employees to do it again. And then we have another hurricane coming in, and hopefully that's the last one of the year.
Well, that's the incredible thing. You always have people raising their hand.
Yeah. Well, it's the nature of what we do. As I said at the beginning, you're in healthcare, and your tie is into the veterans, as well as many of our veterans. 33% of our employees are veterans, and they're out there doing it as well. So
Most definitely.
So you mentioned obviously a lot of things that you've been working on, a lot of things that are going on. How do you find time for a work-life balance? You mentioned at the beginning that you don't really even have time to read. So how are you finding those times other than going to your son's wedding?
Yeah, that's really a great question, and I think it's the same for all of our professionals. I mean, everybody's working overtime. Everybody's working really hard. It's something I've probably struggled with my entire life, is making sure that I have time for myself, my family. I've always made my family a priority, which is why I think I'm still married, and work, and they're all incredibly important. But I think it's important for all of us to take some time and think about me, right? I just signed up for the Whole Health program a couple months ago here in VA because I'm a veteran myself, and so I think it's really great for those for those listening. If you're not aware of the Whole Health program, it's a really great program. You get a coach, you get some help with understanding, how to sleep better and move better. And so I've made some goals for myself: take more time to exercise, get better sleep, eat better, all those things that we all say that we should do, but I've really made it a focus. So that's probably how I try to keep that work-life balance.
You mentioned Whole Health, and you're very passionate about the whole woman veteran program. Mm-hmm. So maybe you could describe a little bit about what that is. I'm not sure if everybody's aware of what that is and how long that's been going on.
Well, so I think this organization has made women veterans a focus for many years now. Dr. Hayes, who works on your team, Patty Hayes, has worked very hard to enhance the women's health program in VHA. I mean, it's our largest growing population.
Yes.
We have about 30% of new enrollees are women. And I think we serve now about 570,000 in VHA. And, as a women veteran myself, this is personal, I get my health care in VA as well. I think we're doing a good job, but I wanted to raise it to a new level, right? And I feel an opportunity and really an obligation to do so as the first acting female deputy secretary. And I think we serve all of our veterans well, but I want to make sure our women veterans know the great resources and services that we have. Some facilities are really good at taking care of their veterans, I think, and that's another thing I look at when I go out and visit. Some, I think, could use improvement, and so it's really learning from others on best practices. Right. We're doing a lot across the board. I'm really excited. We just announced this precision oncology.
Oh my goodness, I'm so excited about that.
That is just one of the biggest things. I'm very excited. Working with our academic partners, we're going to make sure that our women and men veterans that have breast cancer get access to the clinical trials and get the best research and the best oncology doctors working with, like I said, academic. We're going to make some announcements on that here at the end of the month. But so it's really just taking a step back and looking at what we're doing for our women veterans and how we can push that to the next level. Another thing that we've done is incredible outreach. We spent the month of September doing 4 different outreach episodes that talk to our women veterans across the nation on employment, on healthcare, on mental health, lots of different ways. We had experts and subject matter experts in to talk, and so it was really a way for us to, again, and reinforce that we have this incredible organization with incredible benefits and resources for our America's veterans and women in particular. So. And I would like to do a little shout out. So this year for Veterans Day, we always say thank you to our women and our men veterans. But this year I'm doing a little shout out to our women veterans. And I want them to know that thank you for your service and thank you for all you've done for this nation's defense.
Yeah, fantastic. And my time in VA, we've gone from women's health being really about a women's health clinic in a facility, and now it's the all wraparound services.
Completely.
And that's those changes have come about, in the last
which is really great.
Couple of years, which is just great. And so, great shout out to women veterans everywhere. And we're lucky to be here in DC where Women Veterans Memorial is at.
Yeah.
As many other things that we usually go to, or we do go to as part of Veterans Day celebrations. And that's just around the corner. It's hard to believe it's just around the corner.
It's a great facility.
Speaking about veterans, I'm going to lead into something kind of a little bit different. So you're a graduate of the Air Force Academy.
I am.
Talk about how that happened, how you got there to start with, and what your time was there like.
That's an interesting question. So I didn't grow up thinking I was going to go in the Air Force. I actually grew up in Minnesota, and I didn't know anybody in the Air Force or the military, for that matter of fact, except for my uncle. He was at the Air Force Academy as an instructor when I was a junior in high school. And I was all set to go to Boston University, got a scholarship for diving.
Nice.
And we went out to visit my uncle during the winter, and I kind of liked the school. I said, you know, this is something that I would like to consider going to. And so I applied thinking I wouldn't get in. I got in. And then it's just kind of one of those things that, how do you say no to that incredible opportunity? I was the 10th class to graduate with women. And so they were just going through that transformation of having women cadets. And I would say that some were accepting of women and some were not. I think the military has transformed a lot since then. We've really come a long way, and now all fields are open up to women. And I've seen that transformation throughout my career. But it was an interesting 4 years, and at the time, I wasn't sure that I would serve a career in the Air Force. Having said that, I served 30 years, almost 30 years, and I loved every minute of it. And I think the Academy's changed a lot and transformed to make sure that our women feel welcome and are participating in that great organization. So that's how I got to be where I am. I actually, it's interesting, I said I was going to do 5 years. And then I did my active duty for 5 years, and then had my second child, and then realized that I wanted to go back and do more. And so I went back in the reserve, and then did another 15 years of active as a reservist.
Okay.
So retired with 20 years of active duty.
Wow.
So it was a great career, loved every minute of it, great way to serve this nation.
Wow. It's so funny. We have some similarities in that. Not that I went to the Sergeant Major's Academy. Not the Air Force Academy.
It's just as good.
But, yeah,
it is.
But
just as
same
important.
thing. I did. Went in trying to do 4 years. I did 8 years. I got out. Did 2 years reserve, Army Reserve, and then went into the Army Reserve as an active Army reservist.
Oh, so
I didn't
same
know
thing.
that. Yeah, it's very similar.
Yeah,
I did 25 years total active duty.
Okay.
Yeah.
That's
Interesting.
great.
I didn't know that. I didn't
Yeah.
know something.
Well, that's what's great about the Guard and Reserve. You know, it's and that's what I love for our women service women, is that they can have some flexibility, right? They can take some time off and be with their children, help them grow up, and then go back and contribute the way that meets their needs. And that's why, you know, what worked for me. Had I been in active duty all those years, I don't know that it would have been the same, right? I would have had a lot more challenges with family and everything else. But it worked for me. You know, everybody's different.
Right.
Everybody has
Right.
a unique, you know, service career. But that's what worked for me, and I enjoyed it.
Well, obviously it did work for you because you're here today, and we're very glad that you're here today.
Thank you.
You talked earlier a little bit about innovation, and obviously we're focused on EHRM because it just went live, but we've
Yeah.
also had successes in the Caregiver Go Live program.
gosh, yeah.
DEMLS went live this year. Again, we talked about this as in relation to COVID and how we've been able to continue. What's kind of looming in the future? What are some of the things that you see that, as far as innovation is concerned, that we're going to be focusing a lot of energy on?
Well, I'd like to take a step back first and talk about all the innovation over the last 3 years in this department, because it's really monumental. It's historic. Obviously, we went live with the Mission Act
Yes.
a year and a half ago. That was the biggest test to this high reliability, you know, emotionally intelligent organization where everybody kind of pitched in and made it happen. Incredibly successful. And then we rolled out a number of other initiatives. We did the Cole-Mary GI Bill enhancements. We did the Peels modernization. We did Blue Water Navy implementation of this massive.
Yeah.
We've, like you said, we did the Columbus go live with the scheduling solution
Service
this
package.
summer. We did the caregiver expansion in September, and then this week, obviously, the electronic health records, and that's just a small portion of what we've got going on. We have HR modernization going on. We have financial management and budget system modernization going on. It's given me gray hair a little bit, but it's incredible to see this organization. Most organizations wouldn't pick one of those to do in 2 years. We picked probably 5 to 10 massive transformations, partly because we had to, legislation, forced us to,
right.
but partly because it's just the right thing to do. And so we made it happen. Going forward, I think we're going to continue this electronic health records modernization. Hopefully we can speed it up. I've heard from a lot of your folks in VHA that
so
says
excited.
they don't want to wait till 2027 or 2026. And if we can find a way to push that up, we're certainly going to do so. I think that's going to be the next test. I love the precision oncology effort.
I'm so excited about
I think that is going to lead to faster cures and better outcomes. And you guys are really doing some great things in VHA on that. And that breast cancer initiative is just one part of that precision oncology. But I think overall we're just going to continue to break down the barriers to access this organization, continue to try and streamline the bureaucracy at all levels, and make sure we continue to listen to our staff and our veterans on how to make this organization work the best it can work.
Yeah, and if you think about it, the country's behind us. Largest
definitely.
increases in budget in history, probably. Our budgets are astronomical from where they were even 5-7 years ago when I first got here, and that continues to show the focus of the American people on getting it right. And it also shows that we have had some successes. Yeah, I got here right after the Phoenix issue in 2014,
wow.
and so kind of lived through that part of it, and to see where people were maybe not holding their heads up high. I mean, our employees should be holding their heads up high.
Most definitely.
Not only the COVID response, but all the things that you mentioned and the
Yeah.
successes that we've had and continue to have and will have into the future.
Yeah.
I know we will. So I'm excited about the future.
Yeah, when we arrived a couple years ago, there was a sense of despair a little bit when you went around the organization, a little bit of post-traumatic stress from not only the 2014, but everything else that was happening in the political sphere. And the secretary is a fantastic leader. His first mission was to calm the waters, as he would
Right.
put it, and really just get everybody on his team and get us all focused on, making things better and making this organization better. And so I think I've seen that shift.
I have as well.
Everywhere I go, people are just really happy and motivated and very proud of what they do, and they should be.
They should be. They should definitely be proud, and they should definitely be proud about how they've worked through a trying 2020.
Most definitely.
And as I like to tell people, let's not put too much pressure on 2021 because we haven't hit to that point yet.
I know, exactly. It will be a challenging year. I mean, we know that. COVID's not going away anytime soon, and so we're going to continue to have to deal with all of those challenges and continue to protect our veterans and staff. And I think that's one thing that I would love to make sure that everyone knows is that, I think there's a lot of COVID fatigue out there.
Yes.
And this is one of the things that we talked about yesterday was we need to make sure everybody stays vigilant and everybody stays safe and is continuing to protect themselves both when they are off duty
Right.
and on duty.
Yeah. Remember to wear a mask and use hand sanitizer.
Yep.
No matter where you're at and what
Most
you're
definitely.
doing. And as you said, we wear masks to protect others. And that's the reason. That's again what we do in VHA. We help
Yep.
others, and that's what's so
Exactly.
exciting.
It's a
so
great
glad to be
mission.
here. Yeah, it is. Well, we come to the end of our time. I'm so thankful that you came
This
here.
was fun.
Anything you want to close with or leave our viewers with?
Well, I just love this organization. I know everybody else that works for VA does as well. I love the VHA team. You've got some fantastic leaders in that organization doing really great things. Just want to say thank you to all of our incredible staff and for all that you do every day for our veterans. It's pretty fantastic.
It totally is, and I'm so thankful that you took the time out of your busy
It's my
schedule
pleasure.
to sit here with us and for people to learn a little bit about you and kind of where you see the organization going, as well as obviously the things that where we've been. So, well, thanks again for being here. Thanks to everybody for viewing, and don't forget to give to CFC. I hope you enjoyed today's conversation. A huge thank you to all of you listening. Join us for our next episode where we get a chance to chat with Dr. Cameron Matthews, Acting Assistant Undersecretary for Health for Clinical Services and Chief Medical Officer for the Veterans Health Administration. See you next time.